was okay. I was at work. So my wife called me. She was in pain. She was just off from hospital. She called me. She got some pain. So we just had a conversation, and I told her to go back to the hospital. So I commuted home, took some luggage, and followed her to the hospital. That was around 5 p.m. We were admitted at the maternity, and around 9 is when our prenatal gynecologist came for a first call. I couldn't even imagine the measure of pain my wife was talking about, because she was just talking about pain.
So baby Lennon suffered from a birth brachial plexus injury, which is basically an injury to the nerves that supply the upper limb, which usually happens during birth. When this happens, you get a paralysis of the affected limb. You may have partial recovery. There are some patients who recover about 60% of patients, but even this recovery is not a complete recovery, where you have some muscles recovering and being stronger than others. So the stronger muscles tend to cause what we call imbalances in the upper limb, particularly around the joints. So what baby Lennon suffers from, I met him at about 3 years of age, which was a bit late. Usually we prefer to review the patients at least 2 weeks after birth, then we're able to do any nerve surgeries. But when they come to us at about 3 years of age, we're not able to do the nerve surgeries, but what we're able to do is reconstructive procedures that would correct the different imbalances that have settled as the child has been growing.
And after that, we talked with my mom. She had came like once and like, can you get a pre-statement of the bill? Because probably you can get an idea what is really going on. So that was when I got and got the interim bill. That was in the afternoon. My wife got discharged. And it was like, a nurse came, she came with just some notes there. Can you sign here, you've been discharged? That is all what happened. And it was okay, so we're going home. So when he got the bill is when now I found some tests that have been done on the baby. There was some mammogram tests, there was the cardiologist bills, there were some neurologist bills. And I was like, why this test? Is there anything with his heart?
So what he had was an imbalance primarily in the shoulder and the elbow, whereby the muscles that lift the shoulder and abduct, which is taking the shoulder away from the body, are much weaker than the muscles that adduct, which bring the shoulder close to the body and turn the shoulder inwards. So he had a limitation in lifting his hand up. He also had weakness in the muscles that bend the shoulder, which are the biceps muscles. So usually in this case, we tend to stage the reconstruction. So what we started with was the surgery for the shoulder. And what we do is we release the tight internal rotators and adductors, which are the ones which again bring the shoulder in and turn the shoulder inwards. So this enables his muscles, which the abductors, which lift the shoulder, to be able to now get stronger, and then he'll be able to lift his shoulder and lift his hand. So this increases the amount of activity he's able to do with his affected upper limb. So we did what we call is an anterior shoulder release, where we release the tight ligaments around the front part of the shoulder, as well as one of the muscles which contributes mostly to the tightness in the shoulder, which is called the subscapularis.
Lennon is fine. Bright, I was with him. He was here. Doc is very, very happy with his progress. He just tore his scars, but they're healing. They're scars of braveness. And he's prayerful. He's riding his bike. And we've seen him quite progressive, because he's even flickering his fingers, something we've never seen for the time we have been alive before. And we believe it's progressive. We're still doing dedicated physiotherapy. We have timelines and clinics to see Dr. Jowi. Like today, we'll come in 2 months' time. Created a whole system, we believe so, because she's in contact with our physiotherapist, who is with private engagements with us. But she follows. In our busy schedule, she finds time for Lennon. I think it's remarkable. It's cool of her. May she and PCC bring more smiles to more homes. And may people try PCC. They'll smile again.
So I think this just, in terms of the future of hand surgery, pediatric hand surgery specifically, this just shows that the specialists are available. We have world-class facilities, and this is, we're able to do this surgery safely and well at Kenyatta National Hospital, and we're able to provide services to the larger public in general. Again, in terms of pediatric hand surgery, as I said, we're very few specialists who do it at the moment, but the services are available. We may have some challenges in terms of the numbers because we're quite few, but again, we're able to see them in the clinic, schedule surgery as early as possible, and give our patients the much needed care that they need.